The regulatory floor for mental health chatbots is moving. State houses and medical authorities are converging on a single standard. Unsupervised AI cannot legally or medically provide care. In 1 month, 4 state legislatures, a national crisis line director, and a civil jury all independently reached the same conclusion. These institutional moves signal that relying on Section 230 to shield unregulated chatbots is no longer a guaranteed defense. The emerging requirement is an architecture that routes to a human handoff. State chatbot regulation is advancing with rare bipartisan speed. In Nebraska, the Conversational AI Safety Act passed with a unanimous 49-0 vote. This map shows the scale of the change. With 4 states already enacted, there are now over 70 distinct chatbot-specific bills pending in 36 different states. For a baseline on disclosure and parental controls, lawmakers are looking to Iowa's Senate File 2417, which passed both chambers without a single dissenting vote. For more comprehensive oversight, legislators are pulling from California's requirements for crisis protocols and New York's model for a private right of action. These templates provide a working framework for states to regulate AI safety without restarting partisan debates or guessing at the legal floor. However, the precision of the language matters. Poorly worded text risks accidentally banning the only clinician-supervised AI models that currently have a strong peer-reviewed record. Nebraska's LB 525 prohibits services from representing they provide care, a clause accidentally sweeping up clinician-supervised systems. Illinois wrote this correctly. Their statute bans independent AI therapy while explicitly protecting AI supporting a licensed professional. A single clause is the difference between protecting the public and outlawing the architecture it needs. The civil liability landscape changed March 25th. A Los Angeles jury ruled a platform's design was addictive, leading to a $3 million verdict. The court held that engagement loops and system architecture constitute a product's design. Because design is the product itself, not user content, Section 230 protections do not apply. This design as product theory provides a jury-tested roadmap for pending wrongful death cases against major operators like OpenAI and Character.ai. To defend against these claims, developers must now document 5 specific areas: safety by design, red team results, adverse event logs, crisis escalation records, and clinical oversight. A platform built to absorb user distress without this documented human-in-the-loop scaffolding enters a courtroom without the primary evidence used to prove safety. In this new landscape, undocumented design becomes a source of liability. Market survival no longer depends on the quality of a language model. It depends on the safety of the architecture. An unsupervised chatbot that keeps a user on platform is a legal barrier. A supervised chatbot that routes to a human is a protected bridge. For developers, the task is to build systems that hand off to a human and get out of the way. For legislators, the task is to write laws that explicitly protect that supervised workflow.